So the rotator cuff is made up of 4 tendons. The front is the subscapularis, the top being the supraspinatus, then as we move back, the infraspinatus, and then the teres minor. And typically, you'll get tears most commonly of the supraspinatus, that's the tendon on top, and then either the infraspinatus or the subscapularis, or usually the other 2 that would commonly be torn. Those tendons of the rotator cuff stabilize the shoulder to allow the bigger muscles like the deltoid, the pectoralis, the latissimus to actually move the shoulder for big movements. And when the smaller muscles aren't working, the whole dynamic starts to fall apart and then the shoulder won't function properly and it usually has a lot of pain. I typically do rotator cuff repairs arthroscopic. In fact, I would say I always do rotator cuff repairs arthroscopically at this point. Typically, we'll start with a camera insertion into the joint through a small posterior 1 centimeter incision. We'll view through what's called the glenohumeral joint. That's the ball and socket of the shoulder. At that point, we can definitively see the infraspinatus, supraspinatus, and subscapularis and see if there's any tears. Also evaluate other structures like the labrum and the cartilage inside the shoulder. At that point, we'll typically move above the rotator cuff. So now we're in what's called the subacromial space and we're looking down at the torn tissue if it's a supraspinatus tear. And we'll then, using anchors and sutures, be able to sew all arthroscopically through other cannulas to be able to tie the rotator cuff back down to its footprint on the bone. And we can do that for the supraspinatus, the subscapularis, or even the infraspinatus.